All right, Nicole, come with me. This room has been prepared for the both of us. If you have anything you'd like to hang up, I'll have you use the hook behind the door. Otherwise, have a seat in the exam chair. Okay, now to clean the room, to get the room prepared for our next patient, here's what we have to do. We're going to clean with alcohol the tonometer tip, as we always have done. We're going to clean, okay, let's say I use this stuff. We're going to clean the occluder with alcohol because that's going to be potentially touching the patient's face, skin, possibly their eye. And we're going to put it back in the drawer now that it's clean. We are also going to wipe down any eye drop bottles that were left down here on the counter. Any bottles you take down, stay here until you have a chance to clean them. So we clean the top and the bottle with our alcohol Kleenex. And then they can go back in the cupboard stating that they are clean. The next thing we'll do is we'll grab our spray bottle of bleach and a couple of tissue. Using paper towels, not trifolds, when we actually get them in. I got my spray bottle of bleach. First thing I'm going to do is I'm going to wet my towel. I'm going to start with the slit lamp, the equipment that we and our physicians use. I'm going to wipe off handles, ensuring that this stays moist. I'm going to wipe off the chin rest, the forehead rest. I'm going to wipe off this side because when we move the slit lamp, this is where we hold. I'm wiping the power switch. I'm wiping the joystick, the rest of the table. We also want to wipe down the knobs here. This is what the physicians hold on to move the light. So this knob on the left, the same knob on the right. We're also going to wipe this because this is what changes the light, here and here. The other thing I do bleach is the up and down and the hydraulic because those are most likely used by the doctor. Next, we're going to go over to our remote control. Again, let's keep this moist. We're going to wipe the remote control with bleach. This does not touch a patient, so we can use the bleach solution. We're going to open the drawer, place it in here, signifying that it is clean. I want you to wipe the bottom and the top of the drawer because we have to hold something to open the drawer, and it's either going to be the bottom or the top. Next, we're going to work on the mouse. I pick up the mouse, do both sides. I wipe the table where the mouse goes back down. Same thing with the keyboard. Next, we're going to do the doctor's stool, including the bar that adjusts the height of the stool. Next, patient chair. Last but not least, door handles. We're going to do the door hook, and we're going to do a little bit of the wall. You're going to take the ready sign and put it back on the outside of the door, signifying this room is prepared for us and the patient. So at this time, we're not having patients bringing guests in with them unless it's absolutely necessary. So when we do start seeing more patients and when we do have guests, we also want to make sure that we're wiping down the arms of the guest chairs, and we can do that with our bleach solution.